Daily COVID-19 infections soar to a 10-month high on the back of a growing KTV lounge cluster. The government says action will be taken against errant operators. And a cruise to nowhere cut short as a passenger linked to the KTV cluster tests positive. The 1,600 plus passengers on board are now disembarking. They'd been asked to stay since it docked early this morning while contact tracing took place.
We will take care of our sort of the self quarantine or next wash for next 2, 3, 4 days if there is anything happens. But we are very, very hopeful that nothing will happen.
It was very well done and very fast moving, very smooth in fact.
And they compensate every one of us one more free trip, on the same room. So they are very generous. I think they are doing very well and I'm very supportive to them.
For a closer look, we're joined now by Professor Paul Tambyah, President of the Asia-Pacific Society of Clinical Microbiology and Infection. Good evening, Professor Tambyah. Passengers are being allowed to leave that ship as long as they test negative with this rapid test. Is this advisable, bearing in mind that the COVID positive case, the single case that was found so far, the first one, had tested negative using that rapid test before boarding?
Well, I think it's fine as long as there's good monitoring. So the difference between the rapid test and the PCR test is the rapid test gives you the result pretty quickly, but it's not as sensitive. So in other words, if you have small amounts of virus, if you have viral fragments, or if you're early on in the course of the disease, your test may indeed be negative, as it was with this guy. But, the thinking is that those individuals are less likely to spread the virus. And especially if they've been vaccinated, the chances of transmission are even lower. So I'm sure that all the passengers are going to be monitored very closely with repeat testing to pick up anyone else who might be ill. And assuming that they were all vaccinated, the chance of onward transmission from them is actually very low.
Speaking of that, Professor, the COVID positive case detected on the cruise ship today, how different is the transmission risk on board compared to earlier on in the pandemic when we didn't have a vaccine?
Well, there are huge differences, I think, between the World Dream this week and the Diamond Princess in Yokohama early on in the pandemic. Well, first of all, we have vaccines, which are likely to ensure that everyone, including the index passenger, even if they do get infected, they're unlikely to become severely ill. Secondly, we have better testing. And so, everybody got tested with a rapid test. They also presumably got tested with a PCR, which takes a bit longer, but is much more accurate in picking up cases. And in general, I think if all the passengers and crew were vaccinated, the risk of a large outbreak on this ship is very low.
The initial passenger who tested positive, Professor Tambyah, he's linked to this rapidly growing KTV cluster. That's recorded 53 cases so far in just 3 days. What do you make of the pace at which this is spreading?
Well, it's unfortunate, but it's not surprising given the recent outbreaks in Taiwan and in other places early on in the pandemic where bars and nightclubs were major sites for super spreading events. It's unclear whether we're at the peak of the KTV cluster or whether the case numbers will go up for a couple more days before they start tapering down. What this outbreak has shown us, though, is that there's yet another hidden group of people in Singapore. Last year it was the migrant workers in the dorms. This year it was elderly cleaners. Now it's hostesses and patrons of KTV outlets. These hidden communities need specifically targeted efforts to contain outbreaks like this one. And hopefully this will work.
Well, the Health Ministry says that the cluster is potentially a big one. How might that be calculated? And do you agree with the assessment? Will it surpass perhaps what we saw at Jewel and Bukit Merah?
Well, there are many factors that go into the size of a cluster, including the number of people exposed, the number of symptomatic people among the index cases, and most importantly, the rate of vaccination among the people who may have been exposed. And, unfortunately, I do agree that this cluster is potentially huge. The one saving grace is there's a chance that many of those who were exposed may have been vaccinated, which will protect them and their households. The big problem, though, is we still don't know how the Jewel or Bukit Merah clusters occurred. And for that matter, how any of the major clusters anywhere in the world, including the Washington State Choir Practice or the Huanan Seafood Market in Wuhan, because we don't know the exact way that the transmission occurred, we can only guess. And there is a chance that this cluster may actually exceed the Bukit Merah cluster, given the pace at which it's grown in the last 2 days, although hopefully more people have been vaccinated, so it may not turn out to be that bad.
Well, one potential complication of this growing cluster is simply the nature of it. And the health minister has given the assurance the testing is going to be confidential, privacy is going to be protected. But if people aren't forthcoming, Professor Tambyah, with the testing, how effective is self-isolation and self-testing going to be?
Yeah, this is a really sensitive issue. And I think, there are a lot of jokes and memes going around about, people are weighing up the risk of their loved ones going after them versus the risk of catching the disease. But in reality, self-isolating is hard to do for most people who do regular work outside of offices. So it's unclear how effective this could be. I think the key is to persuade people that they need to seek medical attention if they're unwell, or if they do a self-test and the self-test turns positive. The reality is people in Singapore and everywhere in the world are afraid of quarantine. But they need to realize that seeking medical attention not only prevents them from developing complications of the disease, it also protects their friends and family. And in fact, if they're identified early, they're less likely to spark off a large cluster and less likely to be blamed by their family and colleagues who are just as afraid of being quarantined.
Professor Tambyah, thank you for joining us with your perspectives this evening. That was Professor Paul Tambyah, President of the Asia Pacific Society of Clinical Microbiology and Infection.